We welcome all of you to the BodyBilt webinar on overcoming ergonomic challenges in today's environment. I am Mike Bartholomew, your moderator, Director of Sales, Operations, and Training for BodyBilt. I've been with BodyBilt for 16 years and I'm excited to host this webinar today. I want to thank there's over 100 people that's on. There was about 250 people that have registered, so I'm sure that there will be a few people joining momentarily. But there are people joining from all over the United States, and I'm hoping that you are all healthy and safe. We at BodyBilt comprehend the tremendous impact that COVID-19 has had on the workforce across all industries. As some employees are returning to work now, more individuals than ever are working from home. And I hope this isn't the case, but this is probably going to be the new normal for some time. We are humbled to have the opportunity to work together with you in response to a new set of work from home needs and to ensure a safe environment during all phases of the work from home transition. BodyBilt was established back in the 1990s with the mission of designing and manufacturing cutting-edge American-made ergonomic products to assist people to work comfortably and productively within the new workplace environment that was created by that desktop computer and the attendant transformation in the sedentary nation of this new work environment. Since then, BodyBilt has continued to evolve as the leader in ergonomic technologies, from seating to ergonomic accessories. Now we are here 30 plus years later, facing a new set of challenges, working safely from home and planning to return to work in a new, safer setting. Our company lives by 4 core values. Those are passion, integrity, commitment, and respect. It is our core value of passion to the quality of life of our customers and employees that brings us and you together for this webinar today. During the webinar, if you have any questions that arise, please feel free to ask those questions. There is a little question mark in the top right corner of the screen, and we will get to as many of those questions as possible with our panelists. And then also, just to let you know, this is being recorded and will be made available to each of the attendees for future viewing. Today we have with us 3 panelists. Rammohan, Maikala, he is in Seattle, Washington, and Ram is a project manager and program specialist, injury prevention and ergonomics program at the Providence Regional Medical Center in Everett, Washington. Ram's current responsibilities include safe patient handling and mobility, development and provision of ergonomics and safety risk assessments of the workplace, and tracking employee-related injuries and developing interventions to mitigate injuries. Before he arrived at Providence, he arrived there back in 2014. Ram was a research scientist for nearly 13 years at the Center for Physical Ergonomics, Liberty Mutual Research Institute in Hopkinton, and I probably blew that name there. I'm sorry about that. Massachusetts. Ram is the current editor-in-chief of Ergonomics and Design, a quarterly peer-reviewed periodical of the Human Factors in Ergonomics Society, and an editor for International Journal of Industrial Ergonomics. Ram is the immediate past president of the Puget Sound Human Factors in Ergonomics Society, and that was from 2016 to 2018. He's also the past president of the International Society of Occupational Ergonomics and Safety, 2016-2017. Ram has a doctoral degree in rehabilitation science from the University of Alberta, Edmonton in Canada. He has his master's in industrial engineering with special emphasis on ergonomics and safety engineering from West Virginia University in Morgantown, West Virginia, and his bachelor's degree in mechanical engineering from Osmania University in India. Ram, say hello.
Hello, everyone. Thank you for coming. Thanks, Mike, and also thanks, Miles, for letting me part of this panel.
All right. We also have Keith Osborne in Seattle, Washington. Keith is an ergonomist with Seattle City Light. He is a certified ergonomic assessment specialist, a certified wellness specialist, and a certified master fitness trainer. Keith served his country for 25 years in the U.S. Army. Thank you, Keith. He worked for Honeywell in Colorado Springs as an HSE specialist and ergonomist for 11 and a half years. While he was at Honeywell, he built an OSHA and Honeywell best practice ergonomics and wellness process, proactively mitigated over $35 million in potential comp risk in over 5 years, and had 0 injuries with high-risk jobs or employees from 2009 to 2014. He joined Seattle City Light 6 years ago as an ergonomist. During these 6 years, he created a multifaceted process in 2014 for the office, field, industrial, vehicle, and work from home areas. He has proactively mitigated over $65 million in potential risk to date and has lowered injury rates by 58% from 2015 to 2019. Say hello, Keith Osborne.
Hello, good afternoon, good morning, wherever you're from. Today, I am glad to be here, glad to share some information with you.
All right. We also have with us Lisa Plec-Wilinsky in Dallas, Texas. Lisa is a senior environmental health and safety engineer at Raytheon. She co-leads the she co-leads the Raytheon Intelligent and Space Ergonomics team. She is a highly articulate and talented professional with a demonstrated track record of development of cost containment ESH program strategies within the manufacturing industries. She is a forward-thinking, innovative environmental safety and health leader with more than 15 years experience delivering cutting-edge business improvements solutions through lean manufacturing and Six Sigma tools in global companies. She is I could probably put their slides up there. I'm so sorry. She is skilled at recruiting and maintaining high-performance employees and teams of experts, a strong strategic planner, problem solver, and persuasive leader through knowledge of industry regulations, known for her ability to produce high-quality deliverables that meet or exceed timeline and budgetary targets, excellent communication and collaboration skills with all levels of an organization, proven record of managing environmental safety and occupational health programs while providing opportunities for developing and implementing process improvements that reduce injury, waste, and cost, as well as improve resource conservations. Say hello, Lisa.
Hello, everybody, and thanks for that wonderful introduction. And we look forward to sharing all the information we can with you guys.
All right. We have a very diverse panel today with all different experiences across all different areas of the spectrum. So first thing that I want to ask each of you, and we'll ask Ram first, is how are your companies or organizations addressing this new working environment? So go ahead, Ram.
So you want to go to the slides, my slide, Mike, or is it
just kind of give us just a real quick 60-second synopsis of what your organization is doing there at Providence St. Health, as far as with what we're dealing with today.
Thank you. Well, like all of us or many of us, our non-clinical staff are working from home, whereas the clinical staff are still on campus, of course, with PPE. In my own case, 70% I work from home, and while 40%, I should say 30%, I come to the hospital and take care of the things I want. So majority, again, working from home, all of I should say non-clinical staff, but all the clinical staff are still on campus in 3 shifts. So
okay.
Yeah, that's
All
our
right.
life, unfortunately.
All right, that is your life right now today. Keith, same question. How are how's your organization addressing this new working environment?
Well, similar to Ron, we have our mission essential personnel that are working at our offices. Those mainly are operations folks, and obviously all our field workers, because if the power goes out, people get grumpy. So we have our field guys out. They work in shifts. Some come in, and then the next day the other guys come in. So we don't have everybody there every day. However, by the end of September, we will have all of our field people in full up to do their work and their services, because constructions are still going on. There's still things that need to be done within the city. Obviously, you have to keep the infrastructure running. We've got a few of our operations folks who work in offices coming in. The rest of them are working from home right now. And it's probably going to be like that. We just got a letter from the mayor, which dovetailed off of what the governor put out. So we're probably going to be in this kind of a mode for the office folks, at least until January of next year.
Okay. All right, Lisa, same question for you. How's Raytheon addressing this new working environment?
Yeah, so we, as the others, most of our folks are working from home. The essential personnel that are responsible for keeping the product flowing and meeting our customer needs are on site, but there's a large percentage of us that are working from home, myself included, which is kind of odd for an AHS person. You can't really do a hands-on ergo assessment when you're sitting in your BodyBilt chair at home. But we've created some communications and guidelines and guidance documents for our work from home population to help provide them with options from equipment to services, meaning virtual assessments. And we're also currently working on trying to figure out who's coming back, when they're coming back. But as it stands right now, the folks who are working from home will continue to do so through the end of the year. And during that time, I believe it's being worked at a very high level on how to come up with who's going to return and who's going to continue to stay working at home, even after this year is over.
All right. All right. Each of the three panelists have prepared about a 3 to 4 minute presentation, and so we will go right into Ram's right now.
All right. Thanks, Mike. Well, like as I said, many of are working from home, and even though, at least in my case, even though we are supposed to work from home 100%, a lot of things can't be done working from home. So non-clinical staff, essentially, they are going to work from home until further notice. Even though they said, okay, up to maybe December, but as of now, from our CEO, what he said is basically, until and unless we get the vaccine, majority of the non-clinical staff will end up working from home.
Mm-hmm.
Okay, and at our corporate offices, from September 1st, they basically asked everyone to take all your belongings, in terms of the keyboards, all the input devices, including chairs. But you have desks. I think the movers or the real estate or the space planners, they will help them to deliver it to their homes. But as of now, again, majority are working from home. So obviously, with all this, our department virtual ergonomics evaluations have increased almost exponentially. In the last 3 months, yes, it did, but now it's going to be even more. And we just can't keep up, and we have been still working on, it's been almost 2 months, still we are working on a working from home package in terms of, amount of dollars, so that, okay, you can buy a chair, you can a desk or input devices. The right amount is still debatable, in the sense we are still debating, but that's going to be a challenge for us in terms of evaluations, ergonomics evaluations, and also the package, okay, because we're all different. And second PowerPoint, thank you for putting that, Mike, is the change in new employee training and education. Part of my job, every 2 weeks, I do training for frontline staff. This is a mandatory law with respect to our state, or rather wherever the Providence is, we do have a mandatory training every 2 weeks. So once the COVID started, just to let you know, I'm not sure if some of you know this, the first COVID case in this country was in our hospital. And it was in January. And luckily, we had a lot of things in place purely because of the Ebola training, and also that patient survived and moved on. But after that, as you know, the whole country is just beyond control. So anyway, so with respect to training, coming back to my change in training, for almost 2 months, or rather I should say for the last 2 months, we have been doing online training in terms of we developed some videos to do the patient handling. But some ministries, that is some campuses, Providence is a Catholic mission hospital, so we call them ministries here. So every ministry, or rather every hospital, is a ministry. So some ministries, they want to go back to in-person training. So how are we doing the in-person training every 2 weeks? We have a mannequin, so we basically use a mannequin, and we do simulations. And of course, during the time, we need, the caregivers or the employees have to maintain a 6 feet distance with obviously with masks. And so that's been interesting because, sometimes every 2 weeks we get at least 40, 50 employees. So we have to split the training. We have to stagger in such a way that we don't combine everyone in one room. So that's been a challenge for us in terms of the training. And the third one, Mike, if you can put that one, is the communication. So every day, like majority of you, we have safety huddles in the mornings with the senior leadership and also all the department leaders. And also we do have a morning video message from the chief operating officer in terms of, the COVID updates and also CDC updates, okay? And the infection control also pitches in during the time. And every Thursday, we get an update from our chief operating officer regarding our campus, how many COVID patients are in, and how many of them are symptom free, or basically we do all the testing here in campus. So we have at least a good amount of data in terms of where we are at. And also, interestingly, injury prevention and ergonomics come under HR. We come under HR. So we get every Friday an update from our HR, the chief HR officer. We do have mental health resources in place. And again, we ergonomics team, we comes under caregiver health services. So we have a single point of contact for reporting exposures and the symptoms, injuries, everything, and also we have express virtual care for COVID related incidents. And just, again, part of our everyday updates. As of now, we used to use masks. So, my own case, I used to get my personal one stitched at home. But if I have to go to the units to take care of any patient handling related incidents, I need to have the mask provided by our hospital. So I can't use my personal mask. And also when I'm front facing in terms of the patients or in the units, I need to have a eye shield as well. So definitely those things have changed compared to in the last 1 month. And also we are doing our best to accommodate the work-life balance in terms of alternate shifts, different work schedules, again, based on how things go. And as of now, we have our own COVID research studies, at least 3 going on in our system. And there was actually the next one is reintegrating. This has been a tough task, but we follow CDC guidelines. If you look at CDC guidelines in terms of reintegrating the healthcare personnel back to their facilities, they do have 2 strategies, a symptom-based and the test-based strategies. I'm just giving an example of symptom-based strategy is at least 10 days have passed since symptoms first appeared. Again, through our caregiver health and also our own, data, or rather our own database, we make sure that we follow the CDC guidelines, but also make sure we get the caregivers back to work at a, at the symptom-free level.
Mm-hmm.
Okay, and again, we have certain definitions which we follow in terms of what is that exposure, in terms of what is the exposure, and with respect to as a caregiver, with respect to the patient, with respect to the family, or with respect to the visitors, or as a caregiver, as an employee, if you go and maybe party it outside, that also there. So we consider all exposure checklists in terms of trying to get the best information out of the caregiver. Okay, so at every place we have definitely, like any other facility, we do have checks in terms of the entrance, and so we do get updates. And the last one is, again, for a while, actually till last month, our vendors or the suppliers were not supposed to come in, and so we do have certain procedures in place now in terms of how best we can get the supplies at a safe level.
Okay.
So these are my 5 points, and I can answer any questions later after our presentations. So.
All right, thank you, Rob. Keith.
Okay, so some of the things that we're doing initially to get people back to work, we've instituted some health screenings in there at each of our City Light facility entry points. They do a temperature check and they do an assessment questionnaire. That's done every day. They come in through the facilities. People are going to be telecommuting unless it's essential to operations, at least through January of 2021. Essential to operations are our field crews and people that work hand in hand with construction companies and other companies that are actually doing physical work downtown in Seattle. The vehicles that the guys use, those are being disinfected daily. There's a protocol for that. It follows some of the CDC guidelines, and we've added some other things ourselves. Workstations and common areas within the facility itself, our SMT tower, a couple of the other buildings that we inhabit, those are cleaned daily. And when people are in those facilities, masks are worn when they're not alone. And by not alone, we all know the drill: 6 feet of distancing. If they're driving vehicles, then everybody is wearing a mask. If there's passengers, if they're by themselves, they don't have to wear a mask. And so we're really working hard on our work from home plan. It's already part of the written standard. We started telecommuting people as a test bed back in 2019. I say back in 2019, it's not that long ago, but we started to do that. So we had already built in work from home into our written ergonomic standards. So we had an idea of how we sort of wanted to do teleworking. People are required to do an ergonomic online risk survey, office workers. It's an annual requirement. This year, though, they're allowed to do one for both their regular office and for their home office. And for folks that are telecommuting, basically their home office is their office. There's a review and an evaluation done by myself for every single one of them. If they're back in our particular buildings, our City Light buildings, then I will go in and do a one-on-one assessment with them if they're a high risk or a very high medium risk. If they're a kind of a lower medium risk or low risk, it'll be a remote evaluation similar to what I do with all of our folks at home. Now, the ones at home, excuse me, they send me photos of their workstation, how they're set up, how they're seated, how they're doing what they're doing at home. I'll ask them for a few measurements, and then we make recommendations based on that discussion that we do remotely. We have a couple of approved equipment lists that have been developed. We've gotten vendor discounts from a couple of companies that are approved Seattle vendors. They've set up nice PDFs for us with some discounted items. And so we try to stick to some of that, but we also stick to already pre-approved equipment lists that we use. That it's basically equipment that I've seen, I've used, I've evaluated over the years, and have determined that ergonomically these are good pieces of equipment that we can do. We're still trying to finalize a reimbursement and stipend for our employees. There's probably going to be a combination of two, because we already have people who have purchased items for their home based on assessments I've given them. And so really, I think the sticking point is what the dollar amount will be for that stipend / reimbursement. How high are we going to go? What are we going to, what is that ceiling? We don't really know that yet. I have an idea based on the assessments I've done and the monetary value of the equipment on average for those assessments, but we're beholden to the city of Seattle, so we're kind of still working that part out. Mm-hmm. And the last thing is, we allow our office workers, some of our office workers, to take their equipment home. Some of the organizational units within Seattle City Light have allowed employees to take certain items home: monitors, chairs, obviously keyboards, mice, footrests, those kinds of things. Mm-hmm. They're not allowed to take the desks, but yeah, that would be kind of weird if somebody walked out with their cube. But they're allowed to take those items home. All they have to do is submit an inventory sheet to their supervisor. So that way, when and if we do come back from this, all that stuff will come back with them. So that's in a nutshell what we're doing at Seattle City Light. It sounds like a lot, and it is, but it's already part of an ergonomics process that's been developed over the last 6 years.
All right, thank you, Keith. Lisa.
All right. Want to go to the next slide? So there's two parts to mine. I'm going to discuss the return to work process that we're working on as we speak, and then also what are we doing for our folks who are working from home currently and possibly for the long term. So, and all of this has been really done in tandem. So there's not really a beginning, medium, middle, and an end. So just keep that in mind. What we did for the business that I report in through, it's Raytheon Intelligence and Space. We partnered also with our missile systems business, so that's the legacy Raytheon company. We created a risk assessment tool that asks 2 questions, and it's intended to be very simple and straightforward. And go ahead and go to the next slide, or the next point here. Go one more. Okay, so here are the 2 questions. So we handed this out to every building, and through a partnership with facilities and EHS and the site executives, we gathered this information, basically walked the site, and our facilities folks also came up with the CAD drawings, because they have all the dimensions of our cubes on how big our spaces are. So we looked at the areas that were unable to meet the social distancing requirements, and also were they able to meet it in few instances, some of the time, most of the time, or not at all. So those are the 3 choices. And then also the second question, we looked at the occupancy estimate. So what is your normal staff count in your area? What is it currently? Because not everybody is on site. Most are working from home. And then what is the plan for those folks that are required to return? And then any forecast of new hires that are essential to the business. And go ahead and click again.
Thank you.
And that gave us a score of red, yellow, or green. And the purpose of this was to have a very high level visual indication of where to go address first. So what we did is the places that were red that could not maintain the social distancing based on the amount of folks in that area, you know, that are basically, some of those folks are working from home, but when they return, we're not going to be able to meet the social distancing. The plan is to put up acrylic barriers that keep people away. They have to be 6 feet from each other, but in some of our businesses we have, or some of the sites I should say, we have low walls. So in those situations, the acrylic barrier will be put up and the person will be asked to sit kind of back to back to help the social distancing. Go ahead. It's not a perfect solution, but it's something that can be implemented pretty quickly and for not a lot of money, meaning, you know, totally wrecking out all of our interior and coming up with a new furniture and new everything. And so we also, the team also looked at, you know, what are our phases of coming back, and the return to work, the phase 1, which is happening now, it's the on-site essential personnel, it's the manufacturing folks and anybody that has to be there. Phase 2 is the prioritized return. Those folks still are working from home, and it's looking at when do they need to come back and for how many days. And then once that happens, the expanded return is when things get close to being the new normal. And then site fully operational is when there is a vaccination that has been identified. Okay.
All right.
So that's this is kind of the second part of that. So in tandem with the work from home folks, we've done several things. The very, very first thing we did is we worked with our medical folks and to address our ADA accommodation people that have current accommodations. And we also worked with BodyBilt, and they are extremely instrumental in helping us streamline our process on what our choices are for those ADA accommodation chairs, so that our medical folks can identify what the accommodation is and yeah, that's not on here, Mike. And then go to a website and basically choose, you know, what chair is going to fit that accommodation. So that's one piece of it. And what Mike has highlighted on the slide here is, in addition to that, we created a work from home ergonomic resource guide. And that was back in May timeframe. And that was intended to help those folks who were working on the kitchen table or on their couch or on their bed or on a fold out table, a cart table, and to try to find things around their home that they could utilize to get themselves ergonomically set up. Because Raytheon had not yet identified what we were going to provide and pay for. And so that was the, you know, let's hurry up and get something out to help people. And in addition to that, we offered a virtual ergonomic assistant. And we send our employees it's a real short questionnaire to fill out. And then we ask for 4 photos, some pretty, you know, prioritized photos, so we get a good idea of what they're sitting on and their posture and so on and so forth. And then we call them and we go through that with them. In addition to that, we updated our online computer user self-assessment and training to include work from home questions. And that has always been a mandatory annual requirement for folks to take. And that's just for us to identify who's a medium or a high risk for us to go reach out to and make sure that we capture them and we try to help them before it becomes an issue. And let's see. Then the other thing we did is came up with a work from home ergonomics catalog that had approved items that our ergonomic teams throughout the company had curated and really pigeonholed to work from home versus the office. And included in that were work from home chairs that we identified that were very inexpensive chairs. I'm not saying they're the greatest chairs, but and they're not BodyBilt chairs. This was for short term because at the time we created this, we were under the assumption that, you know, by this time, August, September, we would be returning to work. And so these chairs were just kind of better than a dining room chair, but we didn't want to spend a whole bunch of money supplying everybody with these chairs. Fast forward, now our company has come up with a stipend for chairs specifically, and our employees have the choice to choose from one of the 7 that we've selected and get fully reimbursed, or pick from a BodyBilt chair or another. If they bought one from Amazon before this communication came out, they will be reimbursed up to $200, which doesn't sound like a lot, but when you multiply that by, I don't know, I'm making this up, 50,000 people, that's a significant amount of money that the company has to spend, which, you know. And then the other thing we did to accommodate our work from home people ergonomically is we offered them a pick up your monitor day. And of course, we came up with guidelines on how to do it safely and a communication that went out across the company. And they could pick up their monitors, docking station, keyboard, mice, and that's that. And if they needed anything else, what's showing on the slide here are some of the just basic items, like a footrest, a monitor riser, you know, wrist and mouse rest, and then the chair. And then every communication that goes out, even right now, we always have these links on request a virtual ergonomic evaluation, or to reference back to our ergonomics guide, or work from home, or to take the computer user self-assessment. So that's pretty much it in a nutshell.
All right. I want to know about the ironing board there.
Yeah, we supplied everybody with an ironing board for an adjustable work surface.
Exactly. I love that picture. Again, I just want to make sure and reiterate, if you have questions for any of the panelists, please utilize the question mark in the top right-hand corner. I've asked Bernie Lynch, who is the president of BodyBilt, to say a few things. And so, Bernie, if you are there, go ahead. I can't hear you, Bernie.
I was unmuting myself.
Oh,
Thanks, Mike. Mike, I can't believe you put me behind these great presentations to follow this group. But thank you, Ram, Keith, and Lisa. What a great, insightful presentations and your practices and your insights. I know we're all learning a lot from this. Clearly, as you guys stated, these new environments are precipitating a learning curve and challenges for all of us. During June, Lisa kind of referred to this. During June, BodyBilt released a document entitled Bringing People Back to Work Safely. There it is on your screen. We were assuming that by now there'd be a migration back to work. We may have been a little bit ambitious as we look back. Keith spoke about telecommuting for those not essential to operations, and Lisa addressed the 4 phases of returning to a fully operational site. And much like Ram and Keith and Lisa mentioned, there was a research report published by McKinsey & Associates. They're a renowned consulting and research firm that many of you may be familiar with. But they published a document recently entitled Reimagining the Office and Work Life. And I'd like to share just a few highlights from that report. But one of the quotes is, they said, leaders will use the lessons from this large-scale work from home experiment to reimagine how work is done and what role offices should play in the future. In that, they were saying before the pandemic, the conventional wisdom had been that offices were critical to productivity, the company culture, and communications. However, April 2020 data now suggests that 62% of all employees are working at home, much like what Ram and Keith were mentioning during this crisis. Furthermore, they stated that it's going to be segmented who will return to work and when, and will it be necessary for everybody to return to work. And then summarized with the recommendations or steps about the next normal. They called it the next normal instead of the new normal because they view that attitudes are changing on the role of the office and the necessity of the office and the expense associated with the real estate. And they said that in each company, all of you are probably dealing with these exact same issues, which are both ergonomic, health and safety, and financial, all kind of in the same ball of wax. Lisa spoke of the 4 phases I mentioned a moment ago, and what I want to talk about is how BodyBilt may be of assistance in this endeavor to you. But before I do that, McKinsey suggested, as many of you have already done, that it is important to identify the most vital processes that reflect on your company and organization's core values. Ram mentioned that. And then identifying the most important processes is one of the next steps. And we ask ourselves, how can our enterprise succeed in this challenging time when everybody, or 62%, are remote? How can brainstorming be done? Ram mentioned, how can training and education be accomplished? Imagine new employees and how they get trained. And lastly, how do we manage? None of us as managers growing up, especially someone my age. Lastly, how do we manage remote operations where people are anywhere but in sight of the office and ensure safety within the home or remote locations? Kind of the ironing board. McKinsey stated these new processes and practices should be constructed and strengthened so that the organization creates and sustains the community and the culture it seeks. That's a mouthful, and that's probably the endeavor that we're all dealing with. The new practices within the next normal may serve as the foundation of the new and hopefully improved operating models, whereby it's postulated that we'll probably all be leveraging the best of both in-person and remote work. And they're suggesting that, and I've read this over and over elsewhere, that roles can potentially be reclassified in employee or business segments. And in doing so, they'll be fully remote, the hybrid, and the on-site, which I think is not a revelation to any of us. So how do we redesign the workspace? Do we use plastic interface between people or the workplace to support organizational priorities? Well, our BodyBilt publication in June did start to address the return to work and how you may do that. And it's not a commercial for BodyBilt. It was really in my mind, was a public service we were trying to accomplish and get a lot of the data from Jones Lang LaSalle and the CDC and the FDA. And what we conveyed was there are things you can do to address antimicrobial and antibacterial surface cleaning and how to protect the health and well-being of your employees and your customers, from a cleaning, a fabric of vinyl selection, and best practices. I'm not going to go through that report, but if you'd like a copy of it, just reach out to Mike and he can email it to you. It is a pretty good compilation of data, as you can see on the screen right now. We talked about vinyls and engineered ultra fabrics that withstand this kind of robust cleaning. Simplified chair controls that don't have as many touch points. Fully assembled product, and things that you can do to at least make it easier to keep a clean environment for people where people are seated in a business setting. And I am going to do a little commercial for a moment. And very shortly, BodyBilt is releasing a substantial new product line, and it's called Cupron. It's the new Cupron, or copper-infused chair product line. The antimicrobial and COVID deterrent properties of copper mesh are well known and have been validated by a number of research facilities, including the CDC, the FDA, and research studies that are a mile long. And as the workplace is reimagined, these new materials and cleaning processes are vital, even with social distancing. Furthermore, we believe, and I believe personally, that working from home is here to stay. I don't know what percentage are going to fit in those three categories, but I think a significant percentage will. Another report that I read from Joseline Sal was talking about the money that companies can save by not having all the real estate and the utilities and cleaning of that real estate. Lisa made mention kindly of BodyBilt's work from home program that was developed in collaboration with Raytheon and frankly Boeing. This happens to be the Raytheon site minus the pricing, and as a service, and it's for our mutual good, for both us and the companies we serve. We're committed to building custom microsites to best facilitate good ergonomic product availability and standardization of that product for your current and future home office workers. And if you're interested in these customized work from home sites with selected, pre-approved by you, BodyBilt products, please also reach out to Mike or any of our salespeople that you deal with. And we can create these relatively quickly. Mike and one of our marketing people are kind of the hub of this, but we understand what your needs are from a price standpoint and a product standpoint and try to do our best to meet those needs. Again, in closing, I would like to thank our panelists, and I appreciate each of you attending and participating. Mike, I'll turn it back to you for open discussion.
All righty. Where we're at now is we're going to go through some of the questions that have come in. And Lisa, Keith, and Ram, again, whoever would like to answer these questions, by all means, speak up first. One of the questions that came in is, here, let me just go. If one question says, if still at home, when is the tentative date to return to the office? And I think some of you addressed that. I think, Keith, you said the first of the year, and I think also Ram said the first of the year. Lisa, did you mention that with Raytheon?
Yeah, it's not known. What we do know is that the people who are working from home right now will continue to work from home at a minimum through the end of this year. Mm-hmm. And then those 4 phases is how we're going to reintroduce folks back to the site.
All right.
Mike, at City Light, I can tell you that we are kind of staggering people coming back in, similar to Lisa's phasing in of folks back to work, that kind of thing. That's going to go on till the end of the year, but we anticipate, and just based on analytics that we've gotten from supervisors and whatnot on how people are efficiently working from home, we probably anticipate close to 40 to 45% of our workforce will stay working from home permanently.
Wow. That was kind of a follow-up question that was on here. It says, will 100% return or a reduced percentage? And you kind of answered that there.
Yeah, and there's a couple other reasons for that. The city of Seattle, we've had issues, but they're going through budget cuts. Seattle City Light's got to cut millions out of their budget, and one of the things they're looking at is reducing that office space, like Bernie talked about. So there are some office spaces that we lease that we're looking about getting rid of and moving everybody into the Seattle Municipal Tower. Facilities is already working with downsizing workstations and that kind of thing. So mm-hmm. the idea of being able to keep people at home kind of helps that out, because then we can have smaller spaces.
All right. There's a question on here. It says, what criteria or matrix do you use to determine if your work from home program is effective? Lisa, do you want to take a stab at that one?
Sure. Well, that's a really good question. And we've all been in the firefighting mode and trying to just scramble to produce and provide good quality content for our work from home population. So in terms of measuring the effectiveness, we haven't actually had a team meeting about, what's going to be the metrics that we use to determine if this is successful or not. We do keep metrics on the work from home and the computer user self-assessment and the training. So that is one way we will look to see the amount of folks who are filling that out, and because I have to fill it out every year, and specifically from probably last month going forward, we'll look at that with a little bit more scrutiny, because it is work from home and it's a little bit of a different dynamic and different results than our typical office answers.
Mm-hmm.
So that's what I've got right now.
Okay. Anybody else want to add to that?
Sure. We use an online risk management tool. So when people do either an office assessment or a home office assessment, it's noted as a certain location. So as I look at data and the analytics that come in through that, I can actually parse out who's working where, and then where those high risks are, where the medium risks are. And then as people do follow-up assessments based off of one-on-one assessments, remote assessments, I can kind of see where we're effective or where we kind of need more work.
Okay. All right. There is another question that that's on here from Patty Rankin. And Patty asks, have you considered uploading break timer software like RSI Guard to help people take breaks? Now, I know some of you may use that at the office. Do you use that also at home, for those of you that use it at the office?
It's funny that RSI Guard was specifically mentioned, because we just signed a contract with them. That was weird.
All right.
But yeah, and no, it's cool, because I think those are very important, especially if you have a lot of your population that has sit-stand stations, or a lot of folks that do office intensive type work, bookkeeping. You know, for us, it's billing and customer service, so they're at their workstations a lot. They can remote into their computers that are back at their normal offices, so that software will pop up even if they're at home.
Okay. Lisa, are you?
Yeah, similar.
That?
Yeah, we've had RSI Guard specifically for years and years, and we continue to use that. And in the work from home guide and guidance in all of our communications, we mention in every single one more than once that the criticality of getting up and stretching every hour, or at least moving. You know, when you're involved in something, people, an RSI Guard comes up or a timer comes up, it can be disruptive, but we still encourage folks to get up and stand or march in place or walk to the bathroom or go get a cup of water or something. So yeah, it's a very important piece of our being a little bit more proactive. And we also have updated our stretching guide, and we've handed that out and made that available to folks. And it's equipped with like 30-second videos of how to do the stretch.
Okay. All right. There's a comment or a question from Jeanette. I hope I pronounced that correctly. It says, additional input from presenters or participants regarding stipend amounts, or how companies are assisting with the provisional of ergonomic products for work from home employees would be helpful. So can you elaborate? I think Keith,
Yes.
I know, Keith, I thought you mentioned stipend, and Lisa, I know that you mentioned stipend. Ron, did you mention stipend?
Yeah, so we are still working on it, because I think tentatively kind of we were looking at $1,000. But still that's not written per se, you know, but we still are in, you know, in terms of the discussion with our senior leaders in terms of what's the right amount. And also, I just want to touch base, you know, I think in terms of bringing back to office, it's, I mean, you know, it's not, I mean, I didn't say the next year, but it's more of a, it's still, we are not sure unless we get the vaccine. That's according to our CEO, basically saying that, you know, for foreseeable future, majority of this office related employees are not going to come back to office, you know, rather to work in terms of,
right.
So that's one thing. And in terms of RSI Guard, we so, Providence used to be on its own, but we merged with St. Joseph Health in California. So St. Joseph Health has been heavily using RSI Guard. So I think if I am accurate, in September, we might end up, that is Providence employees might end up using the RSI Guard too.
Okay.
So I just thought I'll pitch in with all the past questions.
Oh no, that's fine. There is and Lisa, you mentioned $200, and Keith, I'm not sure if you mentioned a dollar amount.
No, the dollar amount's still getting batted around. It's
Okay.
probably, if I were a betting man, I would probably say it's going to end up pretty close to what Ram stated.
Okay.
But it's going to be a combination of reimbursement and stipend. So
Right.
as I said, some of our folks have already purchased equipment.
Okay. All right. There is a question that came in that has come in from Richard Morrison. It says, is there an average amount of space for a home work area? Do I guess my question is, and Richard's question is, do you encourage people to just sit at the kitchen table, or, put a table off into the side of the room? How much area should you devote to your home office if you're working from home?
Oh, that's a good question. Wow.
It's a great question. It all depends on how many people are going to use it. In the sense, if your kids are also working, your spouse is working, everybody's battling with, the same space, that can be very tricky. I mean, in my own case, I have a small desk which I use. Fortunately, I can move, but it's not a great desk. But at least, but it's a tough question. I don't know how to answer that.
Yeah, that's really hard, and it's I'm lucky because my wife allowed me to have an office in the house, so I have a whole room. A lot of it has to do with like what Ram said. How many other people are involved in having to do? Are you homeschooling folks? Are you working by yourself? Is your wife also working from home? Or your husband working from home? Your significant other? There's a lot of factors that go into that, and also, are they working out of a one-room apartment, or do they have a house? So, and what I tried to do for City Light folks is I did a bunch of videos to try to address as many of those scenarios as possible. How you could either manufacture a decent ergonomic setup or go out and buy equipment to make that setup even better. So.
Okay. All right. Another question came from Heather McBride. It says, are you having difficulty with people requesting remote assessments? And any of you can ask that question.
It's an interesting question, because personally, after started these virtual evaluations, still there are a lot of people who hate remote ergonomics evaluations. They don't want to send the pictures, they don't want to take measurements. They still say, can you come and have a look at my space? Just for example, yesterday I had to go for training to Olympia, so it's around 1.5 hour drive from here. And this lady said, can you come? So I said, okay, if there's a clinic or some place I can come, but I can't come to the home purely because I don't have an approval from my director to go to the homes, take care of the assessment. So I ended up going to the clinic and took care of it. But she's one of those, unfortunately, she still says that, I want someone to look at my space, in person. I just, don't like it. So we have been struggling with, we developed kind of a, I should say, checklist or the case, in terms of, why do we need remote evaluations? Why is it important? And so we have that. Go ahead, Lisa. Yeah.
Oh, sorry. I didn't know you were done. Are you done?
No. Yeah, go ahead. Yeah. So
I didn't mean to interrupt you. So for us, it was interesting because from the very beginning, back in March, when all this started, me being the ergonomist, I immediately called my BodyBilt rep, and I immediately called a guy who could help me with a desk. And, luckily I have enough room to house those things. But then I asked the question to the other ergonomists within Raytheon, how many folks have reached out because they're not comfortable, or they want an ergonomic assessment, or they need to figure out how to make what they have work. And it was shocking and surprising that every single person said, nobody has reached out. We didn't get any ergonomic requests for assistance. So to me, one of two things. One is they thought, oh, this is a short-term gig and I don't have to really worry about it because I can live with the being uncomfortable and in this cramped space until we come back. And now when our CEO, Greg Hayes, got on the computer and did a video on, guess what, guys, I hate to say it, but everybody who's working from home is staying that way until at least the end of the year. Then people started raising their hands saying, okay, how do I do this efficiently and safely? And it is a very individual answer because, I mean, I had a guy who was working in his TV room that had this giant TV, and he literally was sitting on a cart table with a folding chair with pillows on it while his kids, you know, ran around and watched TV. And he's an engineer, for Pete's sake. So he's making us money. So, I think you guys both touched on, it's a very individual. I don't know that it, needs to be 2 feet by 4 feet. That's a really small place, but, I don't know that the amount of space is necessarily a requirement. I think what's important to note is the psychosocial value, meaning whatever helps that person concentrate. I mean, some people can concentrate with a bunch of mess around them. I cannot. So if whatever that is for that person, to, even if they have the smallest space, is to identify those items or those motivational things that help them be successful and productive throughout the day.
Okay.
Yep. Totally agree with that. Yeah.
There's one other question that came up, and it says, have you seen, it came from Patty Rankin, have you seen an increase in workers' comp ergonomic claims since employees have been working from home?
Short answer is no. It's actually gone down.
Okay. Lisa?
And no for us. No.
Ron?
I don't know. I don't know whether I can answer that, but that's been a tricky thing for us, honestly.
Okay.
Yeah. Sorry. I can offline. I can answer, but no. Sorry, I don't want to.
Okay, I appreciate that. We are at 3 minutes after the hour, and we were only wanting to go 1 hour. And so, again, I appreciate each and every one of the panelists, and I appreciate the attendees that were with us today. We had at one point in time, I think the number was 160 or so. So thank you for all of you that spent an hour of your day with us. Again, thank you to the panel. And if you have any questions, I think you all have the ability to get in touch with me. I'm going to give you an email address real quick. If you want to send any additional questions and have any of the panelists answer them, I can get them to them. But the easiest email address to get to me is mike@ergogenesis.com. And if I would have planned, I would have had it pop up on the screen, but I did not. So it is mike@ergogenesis.com. mike@ergogenesis.com. Again, any parting words, Ron?
I mean, the way things are going on, I think apart from ergonomics, I think we might end up with OCD. I don't know, because we keep on washing so many times. We are washing. I mean, it's just becoming a compulsive disorder. But I think working from home for a lot of people has been good. I think you should keep it that way. But there are still some, we get these requests through our core leaders saying that, this person is not, that at home is not conducive. So we have to find some other space. So we are looking at those options as well. So, I mean, there are definitely some challenging times, but I think we can get through it. That's my honest view.
All right, Keith?
I think a lot of companies have found out through this pandemic that Six Sigma lean principles were kind of thrust upon them, if you think about it, because now they're realizing that they can have a smaller footprint. They can have less at their fixed office, and then they can do other things remotely. I think it's going to show a different level of efficiencies for a lot of organizations, but there's going to be a learning curve to it, and they just need to be patient.
All right, Lisa.
So I would say out of this terrible situation, the silver lining is all the creativity that has been shown in restaurants, in businesses, in companies. And I would just encourage the information sharing on if there's something unique and special that's really working, is to share that across the community, because I think that's going to be helpful not only for our employees but our business and our industry. So I would just say, you know, capture and quantify that creativity and share it. And I just want to thank you guys for the opportunity for sharing what Raytheon's doing, and for everybody who's on the line. Thanks so much for spending time listening to us today.
Yeah.
All right. Okay.
Thank you. Thank you.
Again, thank you for your time today. We hope that the information that was discussed was informational, was helpful, and that maybe you all may be able to put it to use. It is, again, we went 6 minutes over. I apologize for that. But again, thank you so much for your time today.
Thank you, Mike. Thanks.
Thanks, Mike.
Thank you, everyone.
Thanks, you guys. Bye-bye.
Bye.